Greetings and salutations. Thank you for lending an ear to the Voice of the Times this Tuesday, March 23, 2021. For today's editorial, now is the time to create a health agency for disease control and prevention. If the coronavirus pandemic has seared anything into the public mind, it is the fact that our public health system and health infrastructure are sorely lacking 1. An agency to formulate, design, and coordinate public policy to address a national health emergency or pandemic, and 2. A central agency for disease control and prevention, similar to what most modern states have. As things stand today, the Interagency Task Force for the Management of Emerging Infectious Diseases is too ad hoc, provisional, and unprofessional to serve as our principal policy-making tool for managing a health crisis, such as a pandemic. There is more policing than policy design and evaluation in its operations. The Department of Health, as the regular Department for Health Services in the executive branch, has a huge bureaucracy to run and control. We should not expect it to double up as an agency to handle disease control and prevention. It is imperative, we think, for Congress to turn its attention now to passing a modern public health law that will address these concerns and create an institutional answer in time for the next health emergency. We have today a score of health laws in the statute book, but none of these laws fill the need for both an effective agency for serious public health policymaking and an agency to handle disease control and prevention comprehensively. Congress spent time, resources, and personnel to establish malasakit centers across the archipelago, yet the centers seem to have no role to play in fighting the pandemic. The real headaches we are encountering now are chiefly bureaucratic and lack of professionalism and expertise. It's long been recognized that there is a huge difference between medicine and public health. Each has its own concern and area of specialization. In very general terms, the field of public health focuses on healthcare as it deals with whole populations, more applied research, and disease prevention. The field of medicine, in turn, is more localized and concerned with individual treatment, diagnosis, and care. Public health professionals work to improve the quality of life for communities and populations. Rather than treating individuals and groups with direct medical care, they conduct research and disseminate information to the public in order to extend life expectancy, combat infant mortality, and reduce the incidence of communicable diseases. Medical health professionals are also often administrators and advocates for policies that will further those points. Some of the common job titles for people in this field include epidemiologist, health or medical center director, biostatistician, and health communications specialist. Medical professionals also want to improve life quality and combat disease, but they focus on the individual and treatment. Seeing patients in order to treat a specific ailment or repair a breach of the human body because of an accident are the hallmarks of this profession. A big difference between the two is that a medical public health professional cannot treat patients. In essence, he or she cannot practice medicine. Only doctors can prescribe medicine and provide that level of care. We need a good public health law that can point the nation to a public health system and infrastructure that can provide good public health policymaking and effective and timely services to combat and eradicate disease. A dedicated agency for disease control and prevention will be a good start and an excellent investment. It will make plenty of difference and make our country a better place in which to live. And that's the editorial for Tuesday, March 23, 2021. For more news and information, get a copy of the Manila Times on print, subscribe to our digital edition, or log on to www.manilatimes.net. Follow us on Twitter, Facebook, and Instagram, and listen to the Voice of the Times.